Okay, well, good evening, everybody. My name's Michelle Moser. I'm with Makers Compounding Pharmacy. Thanks so much for joining us. And this session tonight will be recorded and put on our website probably in the next few days. So let's get started. So tonight we're going to talk about autoimmune diseases, where they come from, and certainly how we can deal with them. A lot of times when we have positive markers, a lot of times you're told, well, this is just the way it's going to be, and there's not a whole lot we can do about it. And I'm not sure I completely agree with that statement. I think that there's a lot of things that we can do to not only help our symptoms, but also help our long-term issues and our long-term goals. So autoimmune disease is something that actually starts in the gut. It can be a result of a virus. It can be a result of a protozoa, an amoeba. It can also come from other issues, but it can definitely affect more than one target tissue. So if someone is diagnosed with an autoimmune disease associated with the thyroid, like Hashimoto's or Graves', that doesn't mean that those antibodies are going to stay with that specific organ. It can actually interrupt function with other organs and cause long-term and chronic illness. Often, many times, people are diagnosed with more than one autoimmune issue. A lot of times, if they're diagnosed with one, there's others that are underlying as well, maybe affecting other tissues, and they may not necessarily always crop up at the same time, but they almost always show up later in life. And so that's what leads us to believe that there is usually a viral infection that's going on, or there's some other thing that is definitely causing that. We also know that there is a very strong connection between the types of bacterium in our gut and in what supply they're in. And we'll talk a little bit more about that type of testing and diagnosing as we go. So autoimmune diseases are inflammatory responses. Sometimes they're called different arthritis, different types of arthritis, whether it's psoriatic arthritis, rheumatoid arthritis. And what we see is an inflammation in those pro-inflammatory chemicals called cytokines. Those cytokines can have different types of responses throughout the body. They can, in situations like multiple sclerosis, can actually decrease the protective sheath around our nerves, which can then cause degeneration of muscle and spastic movements, as well as a wide variety of other areas, including plaques in the brain. But we also see that these interleukins or these cytokines can have a close association with other issues that we don't necessarily address as autoimmune, but we do address as chronic illness, such as Alzheimer's, Parkinson's, even a terminal disease like ALS or Lou Gehrig's disease. We are even seeing a correlation with other mental health conditions such as schizophrenia. And it's very interesting because when we take a deep dive as to what's actually growing in the gut, we can sort out those problem areas and fix them. And we can then decrease the proliferance of the propagation of other chronic diseases like high blood pressure and even diabetes. So there's a lot of things that can be done. So I wouldn't necessarily take, oh, this is just part of aging, because it's really not. Some of the key factors to keep in mind is that a lot of times there is a vitamin D deficiency. And I find that very interesting because in this neck of the woods up in Northwest Washington State, we do see a significant amount of vitamin D deficiency. So the normal blood range is 30 to 100, but even if you're 30 or 38, they're going to tell you you're normal. Well, really, it's not, right? I mean, that's a very low end, and it really should be closer to 70 to be optimal. So we really try to shoot for that 70 or above blood test. And if you're not there, then you need to supplement even more. And now is a great time to test. I also like to test again in September, October, because as you well know, we don't have necessarily a flu and cold season. We really have a vitamin D deficiency season. So when we're also taking a look at different types of viral infection, whether it's Epstein-Barr or Lyme disease or some of the other cofactors that go with that, sometimes it's more than just a simple virus. Sometimes there is some bacterium that can be a secondary infection and can also cause degradation of the good biome in the gut and a wide variety of symptoms in our muscles and nerves. Some of these little critters kind of hide out in sneaky little places, and it's hard to sort them out and to eradicate them. It does take some time. Smoking is always a key factor because we know how it is so detrimental to the majority of metabolic pathways in the body. But we also need to take a very close look as to what's going on with hormone balance, whether we're dealing with sex steroid hormones, especially estrogen and progesterone and testosterone, but some of the other hormones as well: thyroid function, cortisol, insulin, melatonin, vitamin D is technically a hormone as well. And then we can also do a dive into nutrient deficiencies, whether or not somebody has enough B vitamins, if they're assimilating those appropriately, or we can even evaluate melatonin levels and other protein status, et cetera. But because all of these factors do play in with autoimmune diseases, we do need to take a systematic approach to evaluating those. So some of the triggers for autoimmune disease can be various depending on the individual that we're speaking with or that we're talking to, but we always want to take a look at kind of a well-rounded approach. Got to look at the diet. We got to see what's going on. How many simple carbs, how many complex carbs, what are we doing? Proteins and fats. How does stress play a role? Oh my gosh, stress plays such a huge role in just about everything. And this last couple of years has really been one for the books. I have met so many stressed people that it is showing up in a wide variety of areas, including decreasing hormone balance. And when I talk about hormones, it's not just estrogen and progesterone. It's really about even the other neurotransmitters that act like hormones. And then also whether somebody's been exposed to a wide variety of pathogens. Sometimes it has to do with the soils that surround us, or even as an adult, are we getting into chemicals because of where we work or what we touch all the time? Sometimes it can just be pathogens in the environment. So if you're using weed killers or pesticides, herbicides, those can actually contribute to autoimmune diseases. Even just simply the lack of sleep. We all know that, this changing this hour and skipping ahead an hour has really affected people. And it's finally, here we are at Thursday, and finally are we seeing that some people are coming out of a fog, but even the changing of an hour can really change sleep patterns and whether or not we're sleeping effectively. And medications, whether they're prescription or over the counter, can certainly have an impact because a lot of medications actually cause nutrient deficiencies. So we need to identify those and then supplement that. And then, as I've been talking about, a gut dysbiosis, which literally means the ratio of good guys to bad guys. Now, this is a test that I really enjoy. It's called the 3x4 genetics, and it really is just a one and done. You don't have to do this over and over again. It's a quick little cheek swab. But what I really appreciate about it is that it looks at 36 core insights, and it tells us at this given period of time, how healthy is our brain? What has stress and micronutrient status been doing with our brain? But also, is our body inflamed? So you don't have to be puffy and red to be inflamed. You can actually be height weight proportionate, still have some inflammation going on. That can lead to how well our internal organs and how well are they functioning and are they very healthy? But even it takes a dive into how well do you metabolize caffeine? And that's really important. How well do you assimilate salt? Whether or not you should be someone who exercises like high intensity fit, high intensity core strengthening, or should you be more of a yoga Pilates kind of person? Toni Marthaler is a nurse practitioner out in Green Bank, and she does a lot of telehealth, but she is the local person that does the 3x4 genetics, and she does a nice consulting a session with that program as well. And so I highly recommend that this be part of someone's panel, because a lot of times the genetics or the DNA that we're born with, we don't necessarily die with, and it doesn't necessarily have to be your destiny. So if you have a long lineage of different types of cancers or different types of neurological diseases, you can make dramatic impact on your diet, on your exercise program, on your gut health. And maybe you won't actually turn those genes on, and perhaps you'll be much healthier than your ancestors or even your siblings. And that can make an enormous change as to what happens with your children, grandchildren, et cetera. So you can make an impact. And I will say you can make an impact at any age. You don't necessarily have to start early enough, real early in life, in let's say your 20s or 30s. You can literally make a dramatic impact even in your 50s and 60s and 70s. Now, there's some things that we cannot reverse, but that doesn't mean that we can't make changes for the better. So we may not be able to eliminate someone's autoimmune disease, but we can certainly change it so that we can control the symptoms and work toward a better quality of life. And some autoimmune diseases actually differ in how they respond to a variety of treatments. And there's a lot of treatments out there that are considered biologics. And you see those commercials on TV all the time about how they will help with psoriatic arthritis or rheumatoid arthritis, or even help with a wide variety of autoimmune diseases. And those are helpful, but sometimes they also pack quite a whopping side effect profile. And I think you can hear that in those commercials, and you're kind of like, wow, is this really good for me? But when we're talking about what's going on in our gut, there is a direct correlation to how that will affect our brain. And most people can identify that because if you remember, after eating turkey dinner, after Thanksgiving, everybody gets really tired. And that's because of the tryptophan in the turkey. But also, when you look at the typical Thanksgiving meal, it's so heavy in gluten and simple carbohydrates that everybody just is overloaded and we just want to take a nap. But when we look at specific scientific research, this is where we can make a big difference. And what I really liked about this study is that, it really showed that there are specific peptides that can cause changes in the lining of the gut, which can then correlate to simple metabolites leaving the gut and causing inflammation in the brain. And we also know that about 80% of our immune factors are actually made in our gut, and quite a few of the medium chain fatty acids are made in the gut, which are fuel for the brain. So I like Dr. Perlmutter's book, Grain Brain. It is a very good, well-referenced book. It's very easy to read. And this is an excerpt, it's literally on page 85, that he found on many occasions that when patients changed their diet, just simply removed gluten, that their MRIs changed in a fairly short period of time. And I want to say it was like 6 months where he did an MRI, and he did another MRI 6 months later and found significant changes. So this isn't new research. I mean, we're going all the way back into 2006, and he's actually referencing some material and some information, that goes back into the late 1800s, like 1890s. So we're talking about stuff that's like 130 years old. This isn't new. This is absolutely not new. This is my favorite gut test of all time. And the reason why I like it is because we can make a dramatic impact on chronic illness with this information. So when someone conducts a Biome-FX test, it's literally a stool test. It comes complete with everything you need to collect the stool, to sort and put some in a tube. It comes with prepaid postage. They even give you gloves. And it goes off to the lab. It comes back in a few weeks. Right now we're working on about a 2 to 3 week turnaround time. And then I sit down with you and we go over what's happening, and literally can sort out exactly what's going to be best for you. In what order should we actually tackle this, so that we can make impact now, make changes now, so that you have a better sense of health, a better sense of well-being. We've changed people's hemoglobin A1Cs so that they're actually controlling their blood sugars better. We've helped them sleep. We've helped decrease depression and anxiety. We've helped with leaky gut. We've helped with just irritable bowel. And it's interesting how sometimes we'll target one specific area, and yet when we follow up with the patient, they tell us that, my gosh, I didn't realize that all these other things were going to disappear as well. So they're really pleasantly surprised. This test will also tell us how well we are assimilating our hormones, and there are suggestions about what kind of supplements to use and what not to use. So right now we know that there's at least 40 different identified autoimmune diseases. And the last time I talked to Dr. Pam Smith, I want to say she was talking about over 100. And most of the time, rarely do you have just one. So what can you do? Low-dose naltrexone is my favorite medication to use. It is a prescription, but it is a very low-dose medication. It is low side effect. It has very low drug interactions, practically none. And it also is a very inexpensive medication. It comes in a wide variety of dosage forms, so we can find exactly what you're going to need and what's going to fit your lifestyle. And we adjust those doses usually over about 9 weeks to 4 months, and see a wide variety of changes. Now, not everybody responds real early. Some people who have autoimmune Crohn's or ulcerative colitis respond around 4 months. Fibromyalgia is pretty tough to tackle, but we can do that with low-dose naltrexone, and that takes, again, about 4 to 6 months. But working with an LDN specialist, which I'm a certified LDN master, and I'm one of just a few worldwide, quite honestly. And I work directly with the LDN Research Trust in helping provide information and support to people literally worldwide at this point. But when we're talking about Hashimoto thyroiditis, which is an autoimmune disease where antibodies attack the thyroid gland and actually cause little scars, but it can definitely affect how we are metabolizing anything and everything in our body, because thyroid is the master metabolic gland and it controls every function everywhere throughout the body. There's so many symptoms that are associated with thyroid disease. Everything from anxiety and depression and changes in skin and changes in hair, and even low back pain and like dry eyes and dry skin. And I mean, the list is huge. The list is enormous. But we can use low-dose naltrexone to work specifically to reduce that antibody load, and also then help decrease inflammation and help the thyroid actually start functioning normally on its own. And a lot of times we can change or decrease a patient's thyroid medication. This is a great study that was done at Penn State University Medical School. And this was done a few years ago, but again, still very good relative information. I will say that Dr. Jill Smith is one of my favorites. Dr. Ian Zagon is another one of my favorites, and they are just really nice people. They're really easy to talk to. They're easy to share information with. I ask questions, they share with me, and it's just fantastic. So this journal was literally from 2007, so 15 years old or so, but they found that 4.5 milligrams of low-dose naltrexone over 4 months showed an 89% response, where 67% achieved complete remission of their disease in 4 months. Whereas most other medications that have been used, we were not seeing that achieved. So that wonderful patient outcome was just not seen with other medications. Now, LDN isn't necessarily used by itself. It can be used with other medications as well. So specifically when we're talking about multiple sclerosis, We often use biologics. Sometimes we will use even nutraceuticals, specifically biotin. We have to be careful when we use biotin because it can change our thyroid levels as well. But we do know that high dose biotin has shown to slow down the degeneration of the coating or the myelin sheath around the nerve. And MS seems to be more prevalent in women than in men. And most of the time, people in this latitude across the world are being diagnosed. And I will say the average age of diagnoses is around 38 years of age. Some people are diagnosed much earlier in life and find that when they are pregnant, they actually feel better, but that doesn't necessarily mean that they're cured or that they go into remission. They just feel better. Their symptoms do decrease. And that's probably due to the very high progesterone levels in the body. So this is just a quick little diagram as to what's happening with a nerve. So the dendrites are the ends. And then you have this nerve cell and the nerve body and the outer coating of the sheath that goes around the nerves and how that is decreased. So when we look at treatments for multiple sclerosis, we often use a very low, I shouldn't say low, but a very weak estrogen. It is one of the 3 estrogens that is found in the human body. That men have estrogens just as well as women. We just have higher amounts of estrogens running around. But estriol is the weakest of the 3. It has a very nice high affinity for the vaginal vault. But what we also know is that it does help reduce pro-inflammatory cytokines and tends to be neuroprotective. So it does work in an immune modulatory role, meaning it helps to support the immune system and make sure that the immune system is working properly. Estriol is also found around the surrounding the baby in the amniotic fluid. So it is very protective. And I'm going to give you some citations as to different articles to look up. We also use for aminopyridine. It is commercially available, but a lot of times people are not needing a real high dose. And sometimes the fillers in that tablet tend to be bothersome for some people. So we can compound it with different fillers, and it doesn't necessarily have to be long acting, but it can be. And we often compound that even with low dose naltrexone. And then I mentioned biotin, which is B vitamin, and it has shown very good positive effects on disease progression. It can slow that down over time, and we do see improvement in symptoms as well, but it is used in very high doses, and these are not doses that you can find over the counter. And this is the study from 2015 that literally showed tremendous results. This is a study, again, Dr. Zygon was a part of this study, and I want to say this was from the early 2000s as well. Very, very good study. And by the way, if you need copies of any of these, let me know. We have these in electronic form. Oh, 2016, so not that old. We have electronic copies and we have paper copies, and we're happy to share those with you, especially if you are wanting to go to your physician and ask about any of these treatments. We can certainly support that and provide you materials. When we're talking about balance, we really need to talk about hormones, whether we're dealing with estrogens, progesterone, testosterone, but also some of the precursors to that, which is specifically pregnenolone. And by the way, all hormones start as cholesterol. So if you have high cholesterol and you're using statins to keep that under control, it's not uncommon to have a hormone imbalance. But you could also have a metabolic imbalance because the statins can definitely throw off blood sugars as well. But when we're wanting to find out exactly what kind of hormone status you're sitting in right now today, a lot of times we will use a saliva test to evaluate that. And we can look at estrogen, specifically estradiol, progesterone, testosterone, DHEA, and even the stressor hormones, cortisol. And we find that the saliva is actually a better format to show us what's actually going on in the cell versus serum, which is in the blood, which is literally the blood is a carrier. It's like the highway of moving hormones from point A to point B. And urine does tell us exactly what you're doing with your hormones, but it's not very helpful when we're trying to find a good dose that you are going to be needing to replace what's deficient. Or if you've got some that are in excess, what herbs we can use to actually decrease those excesses. So we do adjust hormones with time. That's why I prefer to use creams, because it's much easier to evaluate what's necessary for your dose. It doesn't interrupt saliva testing at all. And then we can change it if, for example, if your weight changes or you've done a detox, or even if it's summertime versus wintertime, that is something that we do on a regular basis as well. And if somebody's lost more than 10 pounds, even 20 pounds, a lot of times we'll have to reduce or change their hormone levels. So we can also take a look at some of those troublesome symptoms that go along with MS. A lot of times people can complain about bladder control, whether they have spasms or leakage. We can use medications in a transdermal gel to avoid those situations where if you take an oral medication and your mouth gets really dry, or your eyes are dry, your skin's dry, or it just makes you tired, you just don't feel 100%. So we can actually put those in gels to rub directly over the bladder area, and it works quite well. We also use magnesium and guaifenesin. Yeah, guaifenesin is a cough medicine, right? But guaifenesin actually works to decrease muscle spasms as well. And we use those in humans and in animals. And anytime we're talking about sexual dysfunction, because again, sexual dysfunction is conducted on nerves, and sometimes those nerves can change, and we don't want to lose sexual function. So whether we're dealing with men or women, we can definitely help with that. And I will say one thing that's not on here, especially for women, is oxytocin nasal spray. And not only does that help with orgasm, it actually just helps with libido and helps to lower stress. So I think oxytocin nasal spray is fabulous. It's not very expensive either. It's just really easy to use. Low-dose naltrexone, there's been several trials done specifically for multiple sclerosis, and this was done back in 2010. So again, not real new information, but is still really good, relevant information, where they summarized that the effect of low-dose naltrexone on the quality of life of patients with MS in a randomized placebo-controlled trial was very positive. So again, this is another study from 2010 that it helped to maintain stable health in patients so that they didn't progress, but they actually had a wide variety of decrease in symptoms. And that is very much the case when we're talking about Linda Elsegood, who is the founder of the LDN Research Trust. And that's a United Kingdom or a British nonprofit organization. And she was diagnosed with MS back in the 90s and became bedbound to the point where she wasn't able to do anything. She couldn't take care of her children. She couldn't take care of her husband, her house, let alone herself. And she relied on her family to take care of every need that she had. But she found low-dose naltrexone and started taking that. And today she runs a nationwide nonprofit organization, and she does this quite well. It's just been a really great medication. And because of how it works at the cellular level, we use it for a wide variety of indications. If you want more about low-dose naltrexone, we have a website built. It's the LDN Pharmacist, and this is dedicated to educating providers and patients about low-dose naltrexone. We can use ultra-low dose to help people with their opiate addictions, but we can also apply this to veterinary issues, as well as finding the latest research for you so that you can make the best decisions for you. We always have blog posts and seminars and webinars. And of course, you can register for all of our webinars on our website. So the Dartmouth study is an LDN study that summarizes over 900 articles and case studies, but that was back in, let me think here, what was that, 2018. So in the last 4 years, we have had, oh my gosh, 40 or 50 more cases. So they wouldn't be summarized in this, but those case studies done on LDN were showing promise in long haulers with COVID, as well as a wide variety of other disease states, most of which were autoimmune. But the Dartmouth article is one of my favorites that I like to hand out. Digestive enzymes tend to decrease with time as we age, and that can decrease our ability to break down our foods, and our nutrients are then very poorly absorbed, or they're not changed effectively. Digestive enzymes can reduce the stress on the digestive system as well as the inflammation, and it helps us to process our foods so that we can assimilate our nutrients more appropriately from the foods that we're taking in, so that we can maintain good microbiome balance, but also then better brain health and complete body health. Digestive enzymes can also reduce inflammation and pain, reduces sensitivity and allergies, and helps with energy production in the cells. So not necessarily a burst of energy where you want to get going and run around, but definitely the cells that need energy or produce energy, it helps with those more effectively. And we know that digestive enzymes help reduce autoimmune issues and helps with skin healing. So these are just a couple of them that I like a lot. There's actually a third one that we recommend quite a bit, especially for those individuals that are gluten intolerant. And if they accidentally get into some gluten, it helps to decrease the severe symptoms with that. So if you're picking a good probiotic, so when I took this picture I guess this picture is a few months ago, I have since come across the microbiome products that I like a lot, and it's actually not in this picture. But when you want to pick a good probiotic, it's really important to start with something that is going to be most beneficial. And that's where, if we're doing the microbiome test, we're going to be able to target exactly what it is that you need, so that, you're not wasting your money, because let's face it, probiotics aren't the least expensive things out there. And sometimes you need to change them up. Sometimes you need to add things like Saccharomyces boulardii, which is a great anti-yeast product. Some probiotics are kept in the fridge and some are not. And if they're kept in the fridge, sometimes that can decrease your ability to take them because you forget. But then we also need to take a look at the other components that go with the probiotics. And we'll get to that in just a second. So vitamins and supplements, again, vitamin D over 70, make sure that there's a good multiple vitamin B complex and fish oils. Magnesium can be very calming, not only to our brain, but definitely to our nervous system as well. It also helps us to regulate blood glucose levels. It also helps us to sleep, especially restless leg issues. And I like magnesium glycinate the best. Magnesium taurate is wonderful. Magnesium threonate is also very good, but I'd be very careful about magnesium citrate unless you have kidney disease. So this is just a few of those core 4 that we recommend on a daily basis. So, we're all used to having virtual teachers, but quite honestly, we've had virtual teachers for quite some time. And I just want to let you know that we have a wide variety of areas where we can help and answer questions. And this is my personal email. You're welcome to email me at any time. I'm happy to help. And this is the website for our general store, as well as our social media tags on Facebook and Instagram. This is how you can register for our additional webinars. April 21st, we have one coming up on inflammation and chronic pain and how you can remedy that. And then in May, we're going to talk about dermatology, whether it's acne or eczema, even some of the very autoimmune issues such as alopecia. We'll jump into that as well. We offer personal consultations as well as help with balancing and testing. We also provide veterinary medications at Makers Compounding Pharmacy. And we have a beautiful Hallmark store that is currently in full bloom, getting ready for Not only the Tulip Festival, but also Easter and Mother's Day are right around the corner. And if did you have any questions tonight? You can either unmute yourself, or you can type them in the chat, or you can simply email me at another time.